What is IVF? How does the IVF process work? What are the steps of IVF? What are the complications of IVF? What is the cost? Are there any risks associated with the procedures? Today we are going to discuss it all. Hello, this is Dr. Prajnanika, focused on your fertility health, and today we are going to discuss everything about IVF or in vitro fertilization. IVF or in vitro fertilization. It is a process of fertilization in which the eggs are taken outside the woman's body and are combined with the sperm outside the body in the lab. And the embryo which is formed is then transferred inside the womb of the woman. IVF or in vitro literally means in glass. So the fertilization process is occurring outside the body. So let us see how does IVF work. During the process of IVF, we first stimulate the eggs of the woman by giving injections. These injections are very easy to take and can be taken at home. Once multiple eggs are stimulated, we then retrieve these eggs through a surgical procedure. It is a very simple procedure. We use a transvaginal ultrasound and a fine needle to retrieve these eggs. These eggs are then handed over to the lab and these eggs are combined with sperm in the lab. Once the eggs are fertilized, they are grown in the lab for 3 to 5 days and then the healthiest and the best embryo is transferred inside the womb of the woman. The implantation process occurs naturally and usually you get to know whether you are pregnant or not after 10 to 15 days of your implantation. So now let us see who needs IVF. Women who have their both tubes blocked. Men whose sperm count is very poor or nil sperm count. Women who have had lots of treatment but they have failure. That means with medicines as well as other ART procedures, they have not been able to conceive. If the woman or the man has a history of genetic disease in the family, then also IVF can help you to overcome that. If the woman has a history of tubal ligation or the man has a history of vasectomy for family planning and they want children again, then also IVF is a method of choice. In many diseases, IVF may be preferred, such as women with severe endometriosis, if you are having a history of genital tuberculosis. Also, women who have cancer or undergoing chemoradiation therapy may need to undergo IVF procedure for the future fertility preservation. Also, women whose egg reserve has decreased or who are nearing their menopause but still want to conceive may go through this procedure and third-party egg donation for IVF process. Nowadays, many women want to electively defer their childbearing and they might go for elective fertility preservation, which again entails the IVF procedure. So let us understand this IVF process step by step. The first step is pre-IVF evaluation. This is one of the most important steps because this helps to optimize your body conditions before you jump into the IVF process. Many of the patients want just to start off with IVF, but I always say no, first let us evaluate. Let's see what's the status of your body, whether we need to do any corrective procedures before you start your IVF journey. So even the couples may be considering IVF or any other fertility treatment need to get this evaluation so that we can decide what is the correct treatment for them. So now coming up to the main part of the IVF process, that is the stimulation of the eggs and follicular monitoring. So in IVF process, we want multiple eggs to be stimulated. Naturally, only one egg is formed. But why do we want multiple eggs to be stimulated in IVF? So that we can give you more chance at pregnancy. So how do we go about it? We start off by giving some injections. Usually in your body, in the beginning of the cycle, your brain sends signals in form of hormones which is known as the FSH or the follicle stimulating hormone. The same hormone we give in the injections form, but in the much higher dosage than what is produced in the body. So multiple eggs are formed. Usually you get injections for 10 to 12 days. So how do we monitor whether your eggs are ready? That is by ultrasound. So every 3 to 4 days we monitor by ultrasound whether the eggs are growing. We cannot see the eggs, but eggs are contained in a fluid-contained follicle. And once these follicles reach a mature size of 16 to 20 mm, we give a trigger injection which is for the final maturation of the eggs. So the third step is egg retrieval procedure. This is the only surgical procedure that you will be undergoing in your IVF cycle. It is done in OT under a short general anesthesia. We use the transvaginal ultrasound and through a fine needle under the ultrasound guidance, we enter the body through the vagina, go inside your ovaries and retrieve these eggs by suction. So once the eggs are retrieved, these eggs are then handed over to the embryologist in the lab. The next step is the sperm retrieval and sperm preparation. This is also a very important part, and it is usually done in the andrology part of your lab. Usually the semen is collected from the male partner on the day of the pickup, and motile good sperms are then separated through sperm wash techniques and are handed over to the embryologist. Now coming on to a question that everyone wants to know, that is, what is the success rate, or what are my success chances with an IVF cycle? So the success rates of IVF depends on many factors. The first and foremost factor is the age of the woman and the quality of the embryo. Also, it depends upon how your cycle has gone, what is the number of eggs which have been retrieved. Overall, an average success rate is around 55%. This is the figure which is given worldwide. But again, if the age of the woman is less than 30, if you don't have many risk factors, then you can have success rates as good as 60 to 70%. So is IVF for older women, if they have reached menopause or nearing menopause, whether they can undergo an IVF procedure? Yes, you can undergo an IVF procedure, but usually we cannot do it with your own eggs. We have to take eggs from a younger donor. So this is third-party donor program. The eggs which are taken from the younger donor are then fertilized with the sperm of the husband in the lab, and the embryos which are formed are then transferred inside your uterus. So one of the common questions patients ask before starting an IVF cycle is IVF safe for me? What are the complications of IVF, or what are the possible risks with this procedure? So the first risk that can happen with IVF is ovarian hyperstimulation syndrome. We are stimulating your ovaries. Multiple eggs are being stimulated, but this hyperstimulation sometimes may be excessive and can lead to collection or accumulation of water inside your body, and this is known as OHSS, or ovarian hyperstimulation syndrome. Now this risk has been minimized with the current stimulation techniques, with the current injections which we have. We nearly have an OHSS free clinic. The next risk is multiple pregnancy. Again, this is due to procedure itself. Usually we transfer more than one embryo, and so you have a risk of having 2 or 3 pregnancies depending upon the number of embryos you have transferred. This can also be minimized by going electively for a single embryo transfer. The other risk which may happen during IVF is during the surgical procedure or the egg retrieval procedure. So when we are retrieving the eggs, we are using a needle. Even though if it is under an ultrasound guidance, it is partly a blind procedure. So you run the risk of having a bleeding or injury to the organs which are nearby, such as your bowel or the bladder. But these risks in good hands are very minimal and rarely occur. So in my years of experience, usually patients who are coming and we are advising for an IVF procedure, cost always becomes a decided factor. Many patients do back out of the procedure or delay going for an IVF because of the cost factor. And IVF does entail certain things which increases the cost or makes the cost more than other fertility treatment. So let's see what are those. The first is the embryology lab. We have to use many culture media. The embryos are grown in culture media, and this is very important. So whenever we are using these culture media or the things in the lab, we try to use the best quality. Secondly is the stimulation injections. Again, your egg quality may depend upon your age, various other factors, but it does also depend upon your stimulation injections. And the lower cost injections generally contain impurities which may lower the quality of your eggs. So even if you undergo an IVF at a half a price, maybe you will get less eggs and poor quality embryos, and you may not have a good outcome. So all these things tend to increase the cost of an IVF. At PHS, what we have done is we have tried to make it into a package. So usually a part of the package is your stimulation injections, and the part of the package is the IVF procedure, the lab, the procedural charges, the consultations and the ultrasounds, which are all included as in the package. Next comes the extra costs. So many of your IVF clinics will not tell you about these extra costs, and these are the hidden costs. So the hidden costs may vary from 30 to 50,000. So what are these hidden costs? First is the oral medications which you will be taking. Second is any additional procedure you might undergo to improve your success rates, such as your blastocyst culture, your laser assisted hatching. Third is post transfer, you will be on certain pregnancy support medications, and these pregnancy support medications may cost about 10 to 15,000 per month. Again, if you have surplus embryos, these embryos will go for storage, and these storage costs also you have to pay. So together these are your hidden costs, and it may vary from person to person depending upon which procedure is taken, whether you have storage embryos, and may vary from 30 to 50,000. So on the whole, an IVF cycle in itself costs around 1.75 to 1.8 lakhs, and a donor cycle costs around 2 to 2.25 lakhs. Thank you for watching these videos. I hope these videos help you understand the fertility treatment and procedure much better. This is Dr. Prajnanika, focused on your fertility health. For more such content, please like and subscribe to the channel.